Hi there, everyone. My name is Prerak Juthani. I'm actually an internal medicine resident at Stanford, finishing up my second year of training. And I wanted to make this video about the differences between intern year and the second year of residency. I think this can be particularly relevant for internal medicine trainees, but I think this can also be relevant to medical students as they learn what to expect as they go into their intern year, and then ultimately what they're going to be expected to do in their second year as well. As I said, this is always a growing process for me, but I think by actually breaking things down like this, I'm able to reflect on the things that I'm able to get better at, and in the process also think about ultimately the type of doctor I want to become, including how I want to train future medical students as well, right? So with that being said, I'm going to break down both intern year as well as second year of training into four main components, which includes on-the-job work, which means like all of the basics of being on the job, which means writing orders, writing notes, responding to messages, calling consults. And the second aspect is going to be the off-the-job work, which you have to really think about big picture. So much of medicine is thinking about all the things that need to get done, but a lot of it is also thinking about in the future, what else do we need to do? Or if the patient were to deteriorate, what would be the plan? Similarly, the third aspect that I want to talk about is going to be clinical reasoning, as well as the overall intensity and goal. The clinical reasoning is all about thinking about what's going on with my patient, how can I best address the patient's need, and ultimately, how can I make sure the patient is safely discharged from the hospital? And the last part is just a summary of the aforementioned three components, which is the on-the-job work, off-the-job work, and the clinical reasoning. I'm going to do this for intern year, and then I'm going to do this for the second year and hopefully give you a good gist of exactly the differences and what you'd be expected to do. This will be focused primarily on internal medicine residency, but I do think a lot of the general tidbits will be applicable to most other types of residencies. So let's start with the first domain, which is the on-the-job work. In your intern year, on-the-job work is huge. Okay, you actually have to do a lot of it, and I actually rate this as 9 out of 10. If 10 out of 10 is the most on-the-job work you'd have to do, intern year, you're going to be doing a ton of it. And the reason for that is because as an intern, I don't think you're expected to ever know all the answers, but I do think you're expected to execute the plan. When someone looks at you, they see you as the main person taking care of the patients that are assigned to you. And I think one of the best ways to learn is to fully immerse yourself in that experience. You'll see that as an intern, you're going to be covering anywhere between 5 to 12 patients every day. And those are patients who are admitted to the hospital, especially in internal medicine. And when they're admitted to the hospital and you're the intern taking care of them, you're expected to know their comorbidities. You're expected to know what medications you're on. You're expected to know exactly why we're going to give a certain medication or why we aren't. And more importantly, if a nurse has a question or if their family has a question, you are the first point of contact for those patients. They're expected to be coming to you because you know them the best, right? And at nighttime, sometimes as an intern, you cross-cover almost over 50 patients. Cross-covering means that you're not just primarily taking care of the patients, but you often are the main point of contact at nighttime if something were to go wrong. And so because of that, you're going to be writing all the orders for these patients. You're going to be writing all the notes for these patients. You're going to be responding to a lot of the messages and calling consults. And while this sounds very, very challenging, I do think it's a reasonable thing to expect to do your intern year, primarily because it's going to get you really on-the-ground experience about what it means to be in a hospital and what it means to be functioning at a very high level. And I think this is a really good way to ease in, because if you can do all of these things well, in your second year when you don't have to do them, it's nice because you can always step in to do these jobs, but you will have done them so often that you're going to be a pro at them, and then you're going to be guiding the other interns to do them, right? Now I want to talk about the second component, which is the off-the-job work. As an intern, you are actually not expected to do much off-the-job work. So you're not going to be expected to think very big picture. Obviously, it's encouraged for you to do that, but we also understand that it can be a very stressful time as an intern, and not everything is something that you're going to know the answer to because you're still learning. So thinking big picture, thinking about what the plan is for the patient, that's not something that you're going to ever be expected to know, and that's not something I, to this day, feel comfortable with. But I do know that as a second year, that's a little bit more of what you're going to be doing. And so off-the-job work means thinking, hey, if the patient were to have this, what would I do? Or if the patient were to decompensate, what would be the plan? And I think that's something that you as an intern are not expected to do, because sometimes you just don't have nearly as much experience as the attending might And that's also not a skill you'll be able to develop when you're working so much. And I don't want you to be hard on yourself. Just know that that's not something you're expected to do. On the other hand, the senior resident or even the attending, this is something that they're doing a lot of, right? Because they're overseeing the patient. They're thinking, hey, if this patient is coming in with a GI bleed, we would need to consent them for blood. We need to make sure they have IV access. These are all the things that we'll be thinking about. And then we often relay that during rounds. And then it's usually on the intern to make sure some of this plan gets executed, right? And so this is not something you're expected to do, nor should you need to do it. I do think by the end of your intern year, it's always good to start thinking about things like this. I still struggle with it, but as I said, I wish I had started thinking a bit about it earlier because this is a big part of the job. And the last part is the clinical reasoning. This is like by far the most fun part of medicine, but it's also one of the most challenging parts of medicine. Medicine is fascinating, but at the same time, it's very ambiguous. Someone could come in with chest pain and it could have a kidney etiology. Someone could come in with anuria, the inability to make urine, and it could be found out that they could have malignancy or cancer. And so clinical reasoning is so dense and there's so many things you need to think about. And as a senior resident and even the attending, this is what you're expected to do. But as an intern, you're not expected to do this at all, okay? At least the way I think about it, intern year is mostly about learning how the hospital works, knowing what it means to be someone's point of contact, knowing what it means to be able to have patients who trust you and how to make sure they learn to trust you and how to make sure you trust them and how to evoke a good history and physical. But then by the time your second year comes around, you really have to start thinking about, hey, this patient's coming in with chest pain. Do I think they have pneumonia? Do I think they have GERD? Do I think they have ACS? If I do think they have ACS, what are the next tests to draw? Do I think they have a PE? If I need to kind of screen them for a PE, but their kidneys are not great, what are the next steps? What are the next lab tests I need to order? As an intern, again, you should not be expected to know this. And I definitely still to this day don't know a lot, but you can always ask and you're encouraged to ask. But as I said, your main job is to think about, okay, once we actually have a plan, how do I implement that plan? If I'm worried about a PE and I ordered a CTPE, how do I make sure that it gets done, right? You have to ask questions, and this is a lot of the stuff about intern year in the latter half that you should be considering doing. Because now when someone comes in with chest pain, you should really be thinking, how do I work this up? But at least when you're starting, that's not something you're expected to do because, as I said, it can be very overwhelming, especially with everything else you're doing. So now if I sum all three of these categories up for intern year, I'd say that intern year is about a 7 out of 10. It can be really stressful because you're getting oriented to the system, which can be very overwhelming. But at the same time, it's not a lot of very high level thinking. It's much more about learning how to be in a hospital and how to be functional in a hospital. So now let's talk about second year. And I've kind of already alluded to what's going to be the biggest difference, right? In second year, you're not going to be doing this as much. And you're going to be noticing that this is actually how a lot of medicine works. As you move more through the process, and even as you become an attending or as you become a senior attending, you do much less of this former aspect and you do much more of the clinical reasoning. And even as an attending or a senior resident, you're going to be doing less on-the-job work. You're going to be doing more off-the-job work and more clinical reasoning because you want to guide the people on your team to the right diagnosis, and you also want to guide them into thinking about how we think about certain conditions. So with that being said, you'll see that as a second year resident, I didn't do nearly as many notes as I needed to, and it's much less intense on the job work because the interns are the main points of contact. Instead of me managing 5 to 12 patients, I'm often managing 20 to 24. And what that means is I need to oversee many more patients than just the interns. And I don't need to know the patients nearly as well, as long as I kind of know their general overarching history of present illness, right? So with that being said, the off-the-job work in your second year is a little bit more intense. It's a 7 out of 10. And I think this is because you have to think a lot about, hey, this patient initially came in with, hypertension. But what do I do if their blood pressure goes above 200? Or what do I do if I think they have hypertensive emergency? And let's say they have hypertensive emergency and I give them an oral medication and it's not working. Which IV medication should I be thinking about using? So this is all the off-the-job work, which I don't think people get enough credit for because I do think it takes a lot of time to think about. And ideally, you want to be thinking really long and hard about this because you want to have good contingency plans. And contingency plans in medicine are so important because you never know when something's going to go wrong. And if and when it does, you have these contingency plans in place so you can make sure individuals get the care they need. The third aspect is this clinical reasoning aspect. And I think, again, you do a lot of this in your second year. Someone comes in with leg pain. Is it cellulitis? Is it DVT? Is it venous stasis dermatitis? If it's just more musculoskeletal leg pain, how do I work this up? Is this something that the patient needs to be admitted for? If the patient needs to be admitted for this leg pain, how long are they going to stay in the hospital, and how can I ensure that they have a safe discharge plan? So this is clinical reasoning, right? You need to think about what the diagnosis is. What is the treatment? What are the risks of the treatment? If I start someone on Bactrim, do I need to monitor them for hyperkalemia? If I do need to monitor them for hyperkalemia, what labs should I get in the future to make sure that it doesn't worsen? So you're doing a lot more of this in your second year. And the beauty about medicine is we're all working as a team. The senior resident on your team may be doing a little bit more of this and this. You as the intern may be doing more of this on the job work. And the attending is doing a little bit more of the clinical reasoning. And by putting all of these heads together, you are providing really good patient care because we're kind of complementing one another and helping one another in the domains that aren't necessarily our own areas where we're doing a ton. So, right, I'm not doing nearly as much on the job work because the interns are helping me with that. But on the other hand, the interns are doing less off the job work, and so I'm helping them with that aspect. So with that being said, I do think second year overall is like a 6 out of 10 compared to the 7 out of 10 of intern year personally, because I found intern year to be very scary and you're just kind of thrown into the hospital. In the second year, you're thinking a little bit more big picture and it's not as much intense work, but you're thinking a little bit more critically about patient care. So hopefully this kind of provides you with an insight into the way I like to think about responsibilities in the hospital. As I said, we're all working as a team, so I personally don't find doing any of this all that stressful as long as we're able to provide good care for patients. But I hope that this was helpful for you because I do think that these are very different skill sets, and I do think I changed a lot during my first and second year of residency. If you found this to be helpful, please drop a like, comment, share, and subscribe. I thank you so much for taking the time to watch this video, and I'll see you all in the next one. Peace.